Well, welcome to Florida Commission on the Status of Women. We're so excited to invite you to be a part of hearing this conversation with leaders that we have within the many different industries. As we've seen, we've gone through so many challenges with the COVID-19, and women are resilient and they're creative and have amazing ideas on how to pivot and to change in order to keep up with the enormous changes that are placed upon us. We have some interesting facts that we'd love to share with you in this opportunity. Myself, my name is Karin Hoffman. I'm a commissioner appointed by Attorney General Pam Bondi. Each of us commissioners are appointed by different leaders within the state of Florida. And we have gathered some of those commissioners here tonight to share their areas of expertise on these issues that resonate with us. And so what I'll do before we get started, so you can hear from these great leaders, I want to go through and introduce the leaders that we have with us here. We have our chair, in fact, of the commission. That's Rita Craig, Commissioner Craig, and thank you for waving. Commissioner Craig, she is just a great leader with business. She was appointed by Commissioner CFO Jeff Atwater in 2016, but then reappointed by CFO Jimmy Petronas in 2019. She is the founder and president of Top Tier Leadership, which is headquartered in Palm Beach Gardens. And she has more than 40 years of global human resource experience, including nearly 25 years at a corporate arena, which is amazing. She's an award-winning international consultant, author, TEDx speaker, and leadership expert with extensive experience in strategic planning, leadership development, and managing multi-generations at work, talent management, diversity, coaching, and facilitation. So we'd love for you to welcome our chair, Rita Craig. Also, we're thrilled to have you. Also with us is Commissioner Jennifer Canady. Would you raise your hand there? Great. Commissioner Jennifer Canady of Lakeland was appointed to the commission in 2017 by Commissioner of Agriculture, Adam Putnam. She is the director of the RISE Institute at Lakeland Christian School, focused on research, innovation, STEM learning, entrepreneurship with 6th graders through 12th graders students. We're thrilled to hear your insights into education, so thank you so much for being with us today. We also have with us Commissioner Dr. Madelyn Butler. Would you please raise your hand? There you go, great. Commissioner Butler, Dr. Butler, was appointed to the commission in 2017 by Commissioner of Agriculture, Adam Putnam. She is an OBGYN from Tampa. She served as president of the Florida Medical Association and is a delegate to the American Medical Association. And another fantastic fact about Dr. Butler, she started an all-women OBGYN practice, and just phenomenal practice. So several doctors in the Tampa area. So thank you for your leadership in that realm. We look forward to hearing from you. We also have with us Commissioner and Senator, our State Senator Gail Harrell. Could you raise your hand there? Thank you.
Oh, hello.
Great. Commissioner and Florida Senator Gail Harrow was appointed to the commission in 2018 by Speaker of the House, Richard Corcoran. She has over 25 years of experience in healthcare. She's worked as a healthcare administrator, managing an OBGYN practice of Dr. James Harrell, and was a founder of Breast Imaging Center, a mammography center specializing in preventative care for women. Her experience in healthcare has made her chair of the Florida Senate's Healthcare Policy Committee, a committee that has really gone to task, and especially in these months. So thank you so much for being with us also here, Senator.
Happy to be here. Thank you.
Great. And then also we have our executive director, Kelly Skiba. Thank you for it. And she is she has an enormous task of trying to keep 22 commissioners running with the different ideas and carrying them out, and really making it available, all the resources that are available with the commission and the staffs of women throughout the state, and also collaborative efforts throughout the nation. So Kelly, thank you so much for being with us here.
My pleasure.
What we'd like to share with you before we get started is some of the facts, some of what has been, the facts that we know to stem the conversation. So we're going to go through this together. What do we know from right now? These are the statistics that are coming out from the COVID-19 in the past couple months. We know that majority of states are beginning to lift their stay-at-home orders and are slowly opening businesses. We see that in different percentages and how they can be filled with restaurants at 50% and such. But we also know because of this that the unemployment rate has skyrocketed to 14.7%. That's like an average. That's 13% with the adult men and 15.5% for women. Now, while employment fell sharply, the majority of those jobs were in hospitality, which lost 7.7 million jobs, or 47% of its workforce. That's in tourism, anything related to that, with hotels in that industry. But also a number of temporarily unemployed people have risen to a record 18 million people in April. Now, there's going to be new numbers, and we can't really get that for you because they will be released for May on June 5th. We'll get that to you. We'll make that available. But it gives you an idea of the picture of what's going on. Even within Florida, women are 51% of the population and really 46% of the labor force. But also, women as breadwinners. Right? 72% of women that are working right now are women with children under 18 years of age. So look at that impact of being with the businesses closed, but then, or if they may work from home, but still they're teaching as the schools have been closed. Poverty rate, that impacts women significantly. Women, it's at 16% compared to men at 14. And we know that those numbers will increase. But another huge concern, single mothers, the rate of unemployment for single moms have risen from 4% to 15.9%. So that's amazing. We wanted you to be aware of what's happening. We can see the occupations that were affected and that women hold in a majority. That'd be administrative assistants, childcare workers, receptionists, nurses, cashiers, retail workers, housekeepers. You can see by that list how many of those are impacted by closures of businesses. And if these are ones that are held predominantly by women, women are really affected in a significant way. Thank you. And then also, we can look at all the different industries. And this is a change in numbers. And I'll explain it real quickly. Like on the first line, the gray would be the men, the change in jobs for men. The maroon line or the red line is women. So you could see the women are affected for the most part, and those primary numbers. Of those numbers, you could see that hospitality and leisure are affected vastly, with over 8 million jobs that have been impacted from that standpoint. Then you go into educational health services, retail, stores were closed. So that gives you a picture of what's been happening. And this is just between February and April, not including May. When we go into education, one of the topics too that we're going to speak about tonight is about education, online learning. Everyone has learned the new phrase of distant learning, Google Classroom and the such. We know that the demand has changed too, because we know that the caretakers are primarily the mothers. So they're working with their business, educating their students. And we also know childcare has been closed, so they're not able to continue with that, having that as a resource. The other factor that is brought into the equation is the digital effect. Those houses, those communities that are able to have technology available for them or broadband services. And those that are missing out on that could be left behind. As we get, we're also honored to have two components and great commissioners that are involved in this with the healthcare, but pregnancy, that's one of the issues that we'll talk about. The hospitals, making sure that pregnant women are not exposed to this illness. Also, an issue that has been taking place is that people are refraining from going on to preventative healthcare or getting a checkup from areas that they are concerned about because of fear of being exposed to the virus. So we'll talk about that. And then also the emergence of telemedicine on a whole new level and the results of that. And so we'll look forward to hearing more insights that cover all of those subjects. Mental health, we know that this has been a big toll on people. if they're not struggling. But those that are struggling, you could see that the 45% of adults will have their mental health affected. That's a significant percentage. And 19% will have a major impact on that. So we want to be able to encourage each other, and we're looking for that. This is an opportunity for positive information of how we can move forward. How can we be equipped? How can we be better? And how can we make positive changes, not only for ourselves, but for those around us. For those around us, also, we're talking on elder care. We know that they're the highest risk of the whole spectrum of life, and we want to make sure they're protected. We also know that just over 1,200 COVID deaths have resulted from those in long-term residence. That's in the state of Florida. So that covers about half of the deaths from COVID-19. So being able to protect the separation, how to come up with creative solutions, that's also part of our sharing opportunities tonight. And then also women and business. Florida has 1.1 million women-owned businesses. Half are concentrated in 3 industries: in the hair and nail salons, healthcare and social services, and then professional services. With that, up to this point, female-owned businesses were growing 2 times faster than all the other businesses nationwide. That's amazing. Florida was 3rd in the nation for growth of women-owned firms in 2019. So how do we bring it back and help women in business not only survive this, but thrive? So we'll look forward to hearing from our experts here on this event tonight. Thank you, commissioners, for making the time. We look forward to just hearing from you. What I would like to do, well, as we go through this, I want to first bring up Commissioner Canady. And Commissioner, your expertise in education, being an educator, and all of the topics that you're doing to equip students and STEM and entrepreneurship, phenomenal. We really appreciate that you're doing. So what are some of the dynamic changes that you've seen in the past months that have covered education? Because we know that as any educator, it's not just your communication, but you're in touch with educators throughout. What are some of the dynamic changes that you've seen from this?
Well, as anybody who has been working with kids, if you have your own children, if you have kids living in your house, you are aware of some of the challenges. But I'll just share a few insights that I think are going to be issues that we're going to have to think through because of the way they dramatically impact families really all across Florida. And the first, as we mentioned in the slide, is that the digital divide is real and it's significant. And it's something that we are going to have to figure out how to better manage. When internet access became a problem, if there was a storm, if your online access was impacted, school stopped. And I think one of the keys for us going forward is going to be empathy. Many of us experienced a tiny little taste of what is a reality for so many Florida families all the time. And so I think that we're going to have to figure out some ways to really focus on equity. And there were some school districts around the state that did some very creative and innovative things. Here in Polk County, buses went all around the county to provide Wi-Fi hotspots. And so that was an innovative way to try to make sure that internet access was less of a problem for families in our district. And so I think that's significant. The other thing that I think is a big takeaway is we know that school is about academics primarily. It's about educating, but we were really, it was really driven home the fact that school is very much about relationships, and it's about relationships with safe adults. And school is about health and safety in addition to academics. And so we're going to have to think through going forward how we continue to build relationships and provide the aspects of life that schools deliver so well. Kudos to school districts all across the state of Florida who really focused on providing nutrition for families and coming up again with creative ways to make that happen. There's so many dedicated food service workers and support staff that really figured out how to make sure that kids didn't suffer because they didn't have breakfast and lunch at school. And then the third thing that I think is a real takeaway is that distance education is very hard for working families. And ways that we can figure out how to support our families who work in frontline jobs, which include things like grocery workers and retail workers. And so I think as we move forward, we're going to have to give some more attention to how we help families, particularly those that have two working parents, to manage what education at home looks like if we were to have to go back to that in the future.
Well, great insights, great recommendations. And that you really encompassed quite a bit from that standpoint of how to bring up the divide. And I love that idea too with the buses providing the hotspots, because it's not every home is equal. It has equal opportunities, equal resources. So thank you for sharing that. One of the things though too is that parents, they didn't sign up for this tour of duty to become educators within their home. And what advice would you give as parents are now transitioning, hoping that possibly schools may open in the fall? How do you, what would you recommend for parents as they go through this summer in preparation for what's to come in August?
Well, I think from everything that I know, if the law allows, if the government allows, we plan to be on campus in the fall. That's the current plan. And I think that there are a couple of things that we can do as parents to help prepare our kids for whatever is to come. And I think this is just generally sound advice, regardless of the situation, but it's really brought home now. I think the most important thing that we can do is really focus on taking care of each other. Now that school, and I think in just about all of the state of Florida, school is winding down this week and next week. We can collectively take a deep breath, and we can really figure out how to work on our relationships. We need to have a collective release of breath. I feel like I, as a teacher, have been holding my breath for quite a long time. My kids are older, and so I'm not dealing with having to educate them at home as well, like so many of my colleagues are. But I think we need to de-stress and work on our relationships. I think we need to work on taking good care of our physical bodies. I think we need to get outside, and we need to get exercise, and we need to do the things that we can do. There is so little that we have control over, but we need to do the things that we can do to really support and nurture and encourage our families. And some of that is taking care of our physical selves. And then I think we need to work on, if we're going to work on our muscles in our body, we need to work on that muscle of empathy as well. And I think with everything that's happening all across our nation and our world right now, we really, I think, can give some focused attention to empathy, to helping kids to think about things from the perspective of others, whether you're being mindful of those that are stuck in nursing homes without visitors, or whether you're being thoughtful about your neighbor next door who lives alone. I think there are ways that we can reach out in grace and empathy to our neighbors. And I think that'll go a long way over the summer to prepare us for whatever is to come.
Fantastic advice to be, which is turn into really a caring state and a caring nation, caring for one another.
Absolutely.
That is really great. And with your, I love the idea too, is like, take care of yourself, because there's a lot of demands on us, but we can easily put ourselves aside, but just making sure that we can take care of ourselves so we can take care of others. Thank you. That is phenomenal. And you also, real quick, you have your entrepreneurship program. And so what would you kind of recommend, any tidbit that you can give us on entrepreneurship?
Well, kids are spectacularly adept at finding the missing piece, the thing that we didn't know we needed. And so, you know, my best advice to entrepreneurs all across the state is to listen to your kids, because they usually, they have some really astounding ideas. The final project for my students this year was, I gave them $1 million budget, and they had to come up with a business concept. And a couple of them use virtual reality to do school. If in fact we had to do something like this in the future, they thought virtual reality would be a great way to be able to see the world with their classmates. So I don't know if there are any venture capitalists out there with a spare. I don't think $1 million would quite cover it, but kids always have great ideas.
Oh, that's astounding. And look into them as resources for that. Fantastic. Thank you so much for that.
Absolutely.
As we move forward, I want to go to Commissioner Butler. And raise your hand again there so we can see you. Perfect. Healthcare is just, that's first and foremost. That's where we're at. That's what we're thinking. We become pseudo-scientists of sorts, of what we've learned and understood, and we're talking about with our friends. But can you share with us tonight the impact on women's health? What is that, the changes that you've seen within your practice, and just giving some ideas. We know that there's women that have been a little more skittish. What is it about babies and deliveries? If you could just share with us your experiences and your insights right now regarding that, that'd be great.
Well, actually, Commissioner Canady provided an excellent springboard for me, because it really is all about mind, body, and spirit. And what we know is that there's a lot of anxiety right now. We know that our mental health professional colleagues are to the max, on the brink as far as patients and having to do interventions with people. There are a lot of patients that are very anxious to access the healthcare system. And I do want to provide reassurance in that we are safer than ever. I think that offices, clinics, hospitals have really gone above and beyond to make sure that we are putting everything in place as far as sanitation, wearing masks, doing everything possible, even establishing special COVID units. Luckily, throughout Florida, we've had a couple of hot pockets, but we haven't had as bad an experience as far as overwhelming ICUs like we've seen in New York and other parts of the country. So I think that's all good. For our pregnant women, I can also reassure them, because coronavirus and pregnancy, we found not to be as serious as coronavirus, for example, in the susceptible, like our elderly, our people with diabetes, chronic heart disease, etc. So it becomes our collective responsibility to help these people by social distancing, by providing them what they need. If we know that there's an elderly person without family members, to help them access food, health care, etc. Also, some of our elderly aren't aware about the opportunities for telehealth. So if you are one of those high-risk individuals, you should still seek care. We're seeing a lot of people that are anxious about going to get the care that they need, and there are lots of opportunities to access that care. However, the elderly may not be as familiar with technology, and that's where we can also be of help by helping them get online and access a healthcare professional. We're seeing a lot of impact with domestic violence. I already mentioned a lot of mental health issues. And I think that our mental health professionals are also there, ready and willing to provide telehealth services, but also it is safe to access those facilities. A lot of times they allow you to wait in the car, and they text you when it's your time. So you don't necessarily have to expose yourself to get these services. Also at the hospitals, they are limiting exposure by allowing, if you're pregnant, for example, going to labor and delivery, you have one support person allowed during the entire time. They're not having the entire extended family coming to visit. So that further creates some anxiety on the one hand, but it further reduces your risk. So I think those things are very important in thinking about this whole pandemic, especially as things open up. We have to use good common sense. I would wear a mask in public. We know that the mask is not 100% preventative. Nothing is, other than just staying at home and having no contact with anybody, which is not feasible. So I think that things are turning around. I think that we have to continue to be vigilant into the fall. when the virus could mutate, but it could mutate for the better. It could be more virulent or it could be less virulent. So I think that, we can look at either the glass being half full or half empty, but we do have to be vigilant. And I think vigilance is a key term for going into the fall.
Well, I appreciate that too. When you go into, you're talking about the fall, there's some people that made me more concerned about doing the normal checkups or addressing some of those issues that are cropping up. As a doctor, what are your recommendations? Is it better for me to wait a bit, or is there a pathway for me to get something checked out? As a doctor, how do you recommend?
I think you should never wait when you have a healthcare concern. The other thing that I recommend to patients is getting their flu shot this fall more than ever. Because although it would be rare, if you get the flu and COVID at the same time, especially if you have any other active medical problems, that would be very, very serious. So now more than ever, and we're also seeing that if you get the flu shot, you may get a little bit of an immune boost that will protect you against corona. So this is a time to get as healthy as possible, to eat well, eat clean, to exercise, to tend to the spirit, so that we can always be as healthy as possible, so that when we are faced with these viral illnesses, we're in the best possible shape physically and mentally to fight them. So now is not the time to walk away from healthcare and getting your regular healthcare. And more than ever, it's a time to get vaccinated.
Great advice, especially with the flu shot is an option. And then that helps us as we move forward to the different phases of opening. And from that standpoint, do you have recommendations yourself as we go through those phases?
I think, again, the social distancing, the hand washing, which is so important, carrying hand sanitizer wherever you go, making sure that after you touch surfaces, I have in my purse hand sanitizer and wipes. I have some Clorox wipes, and just, you don't have to be over OCD about it, but I think that we do have to be careful if we're touching a lot of things to clean our doorknobs, our computers, our phones, our cell phones even. And I think just good common sense, wearing your mask, it's not going to hurt, and it will only help. And keeping that 6-foot distance from others, because things do need to open up as our businesses have really suffered. But it's us, it depends on us to use the good common sense guidance to protect others, especially our most vulnerable.
Well, and that is great to hear, and encouraging also, just as, we can move forward, but move forward safely, cautiously, to look out for those that are around us. That going back to what Commissioner Canady shared as far as that empathy and thoughtfulness of others. So thank you very much, Doctor. Thanks for your time. And that's a great segue. We want to bring on our State Senator Harrell. We're thrilled for you to be with us and serving together with you on the commission. And your position on the Health Policy Committee in the Senate, that really puts you into a unique position as seeing what's happening as you are in direct communication. Before we go forward, can you share just a little bit about what's involved in Health Policy Committee? Some may never have known that this existed, and is now very much so. Now I'm interested to see. So can you share with us a little bit about your experiences on this, chairing this committee?
Of course, happy to. The Health Policy Committee is in charge of health policy for the state of Florida. From a Senate perspective, of course, we have counterparts in the House, and together we work very closely to really formulate the policies and pass the laws that affect everyone in the state of Florida in the healthcare arena. And of course, this last session, we were so excited. It was going to be a dynamite session. The economy was booming. We were at 3.4% unemployment. The budget outlook was fantastic. We had all kinds of great plans for teacher raises, for our environment, for really helping our healthcare system, our seniors, and our most vulnerable, our seniors and our children as well. And then, of course, as we all know, and that we're here today to discuss, COVID happened. And this pandemic descended on the state of Florida, and things changed dramatically. And part of the Healthcare Committee's responsibility is making sure that we have the services there, and we do protect those most vulnerable. And I'd like to just kind of talk a little bit today about what we are doing for our senior population, particularly those in long-term care. And they are the most vulnerable. There is absolutely no doubt about it. And especially those who are in facilities, whether it is one of our almost 700 nursing homes or over 3,000 assisted living facilities. These are the people who are the most vulnerable. They have major health care problems, and we need to protect them. So when this thing hit, we held our first committee meeting dealing with this back in February, about the 18th of February. And we saw what was happening across the nation. And then, of course, it came to Florida, and the governor stepped in. The Surgeon General on the 1st of March actually ordered a state of emergency, healthcare emergency. And then the governor came in a week later with a whole state of emergency across the state. And in mid-March, he closed the nursing homes to visitors. Probably one of the key things that really has made a difference in protecting our seniors and our most vulnerable population in those facilities. And it's a tough decision because it means that you can't have visitors. You can't have family members come. We also require that everyone coming, vendors, personnel coming and going into the nursing home have to wear masks. That was absolutely key. Masks and gloves. You got to have those gloves on too. We also spent a whole lot of money in making sure that we are testing those in our nursing home and all staff members. We're really trying to determine if there's COVID in the nursing home, and then how do you deal with it. There's been a lot of things across the country with major outbreaks in nursing homes. We probably have about 10% of our nursing homes that actually have COVID in them, either through staff or through residents. So we are trying to keep it contained, and we've actually established separate nursing homes. We have 5 of them in the state, where if someone is diagnosed positive, we can move them there to kind of isolate them. And any patient coming from a hospital into the nursing home or an assisted living facility has to be tested before they can be admitted. And if they're positive, then there are options. You have to totally isolate them for at least 2 weeks. You have to have two negative tests in order to be moved into a general population. So we're trying to really contain it as best we can. We've also done major education of staff in our nursing homes and assisted living facilities. The Agency for Healthcare Administration has testing teams and actually instructional teams and inspections that go out and really make sure that nursing homes and assisted living facilities have the training to deal with infection control. That is absolutely key. And also the testing of all staff and all nursing home patients has really helped us identify who has it and then the isolation that comes with it. I think another thing we've done that's really major is these rapid response teams, to send a team in to help deal with it. The overwhelming burden of a number in one nursing home that has, it's huge. We've also made sure that we have the PPEs and have made sure that we have over 10 million masks have been disseminated throughout the nursing home and assisted living facility. We want to make sure that every nursing home, every assisted living facility has the wherewithal to take care of those patients appropriately and protect other patients. So we've really taken the lead in making sure that this is out there. I've watched this very, very closely as chair of the committee. The Department of Emergency Management, Jared Moskowitz, has done an outstanding job. And our Surgeon General, Dr. Rivkes, has just been on the front line. And he got a little bit of a taste in this when we had the Hep A epidemic. Let me tell you, this has been baptism by fire, for him and everyone in the healthcare industry, and everyone, especially in the long-term care industry. It's been very, very hard.
Well, many of us throughout the state, with women, we have family members that are at that age, that are possibly in assisted living or nursing homes. Myself, my great aunt who I take care of, she is in assisted living. I've not been able to see her since March. We talk several times a day. One of the things that I really appreciate about the assisted living place that she's at is the immense care that you are talking about. She's in Florida, immense care that they're giving to protect her and all the rest of the residents. And they give a daily report and to let them know if there was anybody. And so giving a peace of mind to us as family members. And they're working on, they've been giving them tablets to communicate, FaceTime. So they've really gone above and beyond to engage the residents, because it is a difficult time for them. And I know that they're going above and beyond the call of duty as well, because it's all on them. You don't have family members to come in and to help. So it is quite the challenge. Is there some other creative ways that you've seen to engage the residents to bring a smile to their faces in the midst of this? Have you seen or heard of some creative stories?
Social isolation is probably the most difficult thing. And those family members not being able to come in and really see their loved ones and be part of it. So it's amazing what all our assisted living facilities are doing. The state has actually given them iPads or various devices for them to be able to communicate with family.
It's true.
And this good old cell phone is a wonderful thing. And FaceTime, I FaceTime my grandkids all the time. It's wonderful. And FaceTime your grandma, in an assisted living facility or a nursing home. But the staff of our facilities have stepped up amazingly, whether it is, of course, the patients can't leave their rooms. They are in their rooms. There's no congregate dining. There's no entertainment. So things such as doorway bingo, okay? Yeah. Let's play bingo, and we'll call the numbers out and everybody's got their cards sitting at the doorway. Or intercom bingo, how about that? Or, what they've even done? They have dance contests. All the staff dress up in costumes and do dances down the hallway, and you get to vote. But probably one of the most wonderful things I've heard is the community outreach that has happened, where individuals, schools, kids, sending cards and letters to people in the various nursing homes. And to get that little bright, shining card from a kid that's handwritten or hand-colored is just such an uplifting thing for someone who is really very lonely in our facilities, our nursing homes and assisted living facilities. So this is a community endeavor. We're all in this together. And what I have seen that's so positive coming out of this awful pandemic is that community spirit, that coming together, that working together. Together, we're going to get through this.
We value the fact that the state values how important our most vulnerable are. And we are very grateful for the protective measures being placed on them. And that is a tremendous gift. So, Senator, we thank you so much for your leadership in this realm and within the state. Thank you for joining us here too. And it's an honor to serve with you. Thank you. Also tonight, I want to introduce the chair of our commission, Chair Rita Craig, Commissioner. She has just really been a phenomenal resource with her business. And so many women within the state of Florida are in business, or entrepreneurs or leadership within their corporations. So we really want to turn to you and be able to pick your brain tonight from all of your experiences, international and within corporate or even for small businesses. I mean, you have seen this as a challenge like none other, and very creative. I'm asking you if, businesses have had the rug pulled out from underneath them. But right now, can you walk us through a process that a business might need to go through in order to not only survive, but to really thrive on the other side of this? Would you have some insights? I probably need to take a lot of notes at this point too.
Sure, we've been out this for a couple of months now, and I think all of us have seen every kind of business being effective, and some that have done a better job than others at changing and turning this chaos into an opportunity, and I think that's critical. But there's several things I think companies need to do. The first thing, and it's easy to say, is don't panic. If you're panicking, chances are you're going to make inappropriate decisions. And you heard from the Dr. Butler and Commissioners Canady and Harrell about the importance of healthcare and education and so on. I've seen people do that, so please try not to panic and take care of yourself. You know, still get up in the morning, still have a schedule, have things you want to get done, and so that at the end of the day, you can check off that you actually made some progress on your list. Finances are critical. There's no way about it. If you're a small business, medium business, or large business, you need to take a look at your budget and make some tough choices. If you're an individual contributor, you have your own business, self-employed, then you might find yourself in a position where you have no contracts whatsoever. And we'll talk a little bit more about how you need to pivot. But if you have employees, I think it's very important that you send a message that they are the most important right now. I think we're at the phase where safety and security is where people are at. It's not a time right now to market and sell, especially hard sell. I think it's a turnoff. But we'll get there. We'll get there, and depending upon where you are in the state, it might be appropriate. But I'm in the southern part of the state, and we're certainly much more into safety, security, making sure employees are safe at home, and some hopefully will be transitioning them back. So that's going to cause you to look at what your policies are. Do you have good COVID policies in place? Have you taken a look at the company to see if there's physically some changes that need to be made, whether it's plexiglass dividers? Have you purchased supplies for employees, gloves, masks, and so on? And then, are you ready for when employees come back, perhaps on different staggering levels? And then, most importantly, is do you have a policy in place to protect other employees? Because people are very, very concerned that they've heard about this full time, being at home, and they're very concerned about making sure companies have a policy in place so that if somebody does test positive or they're not feeling well at work, that you expedite some kind of action to make sure everybody remains safe. I think that's critical. And I have to add that I do think in the future, how employers take care of their employees today is going to dictate who's going to want to work for you. They're going to be asking questions. They're going to know who the heart of the company is or not. And right now, it's been a beautiful thing. I think it was Commissioner Harrell said, oh, the community involvement has been so good. I think we've seen the soul of a business. I think right now, companies have taken on that role of taking care of employees. Some in a very, very good way, and they're great stories, and some not so good. So I think that's important. We will again get to the marketing part eventually, but I think it's important right now for people to use the time proactively to do those things you never had a chance to do. If you're a small business owner, you might have the inclination of, okay, I'm going to just make an online presence and start selling things. If you don't have a big following, that would be a difficult thing to do. So why not use this time to create a following online? Maybe you have a website that needs refreshing. Maybe you want to show that you're starting to add other services that you didn't add in the past. So those are just some of the things I think businesses need to do to move forward. And to summarize it, I think the most critical thing is to turn chaos into an opportunity. And I can't stress that enough. Look for the opportunity in the chaos.
Oh, great advice. I got some notes here myself. Thank you. One of the, when you're looking at a business, and what would be a list of characteristics that you see in a business that would exhibit the nimbleness or that flexibility, pliability moving forward? What are some other characteristics that a business needs to demonstrate? I do like at the top the soul of that would be demonstrated of a company. You know, that's your soul is exhibited from that standpoint. What are some other character traits that you would see or need to see?
I think aside from you looking at this as an opportunity, it's businesses today are going to have to shorten up their strategic planning cycle to almost a daily, if not weekly cycle, so that we're getting information, healthcare information, education on and the education system. We're getting new education and new information on a daily basis. So it's staying in tune with what's going on, keeping your finger on the pulse of the changes so you can pivot quickly, faster than anybody else. And making sure your employees understand change is good. Change is going to keep you alive. There's so many people talk about, I can't wait to go back to a new normal. I don't think there is a new normal. I think we go back to the constant, whatever shift we're going to have next.
Excellent.
Today is first day of hurricane season. That brings new challenges, especially to our state. So we constantly are going to have different challenges, opportunities that we're going to have to be faced with. So I don't think that we can rest on our laurels and think that change is going to slow down. We're always going to have something that we have to address. And I think those that address that, embrace that, use it to drive their innovation will be the most successful.
I appreciate that. One of the great leaders from Florida had a home over in Fort Myers, Thomas Edison. He said, there's always a way to do it better. Find it. Mm-hmm. And I think that is exactly, too, something from that we as business need to know and be able to apply. Mm-hmm. But have you heard of something creative that some of the businesses have been doing that you're like, oh, that is phenomenal, that you can share and kind of help inspire us also?
Yeah, I think, when you look back in the last couple of months, well, one of the big lessons learned, I think, for businesses is that they can pivot fast when they need to. And you look at the research that's coming out on coming up with some kind of, a shot or whatever for this virus it's fast. It used to take so much longer. I mean, when we need to pivot, I think we've learned we can pivot fast. So I don't think that's going to change. But if you look in the last couple of months, let's take big companies, international level. We have read about many companies that used to produce fine clothing who are now producing clothes for hospitals, throwaway, clothes for the nurses and doctors to wear. We've read about companies that produce products, turn their facilities into a place to produce in-demand products like the hand sanitizer that Dr. Butler talked about. So who knew? But there's a need. They said, I have a social responsibility, and they changed. So that's on a big level. Medium size, I'd say here in Palm Beach County, we are the #1 producer in the nation for a variety of vegetables, like bell peppers and sweet corn, among others. And in the state of Florida, #1 for a multitude of fruits and vegetables. Our farmers here, and I'd say mid-sized companies, they were used to large contracts with restaurants and the school system, finding themselves with crops and no need. So they pivoted, and they were boxing them up, and lines of cars would come out there, pop their trunks, and be able to directly get from the farmers the food they needed. Wow. So that was a beautiful thing. They helped the community helped them, and it was great. On a local level, small business, I happen to know a woman downtown West Palm who's a photographer who, as you can imagine, her business went away overnight because weddings and so on were all canceled. However, she knew how to sew. So she has sewn now over 800 masks. In the beginning, gave over 200 of them away to hospitals and people who needed them. And now she's selling them and giving part to charity, but she needs the money herself. And hats off to her. She got on Facebook, didn't cry, told her story very authentically. And so she moved forward. So I think people are getting very industrious and supporting one another. And I think moving forward, that's where it's at.
Women are creative and innovative, encouraging to one another and seeing a need. So now is really a phenomenal time for women to shine in an amazing way, to become leaders and not retract, but really to move forward boldly. So each of you have shared just great insights to encourage us, to give us ideas on how to be better. And we really thank you for this sage advice. The Florida Commission on the Status of Women is also really committed to hearing from women throughout the state of Florida. And we have provided the survey. And what I'd like to do is I'd like to turn this portion over to Kelly Skiba, our Executive Director, to really set the stage with the survey. So could you help us with that and make it available? We would love every woman in the state of Florida to participate in this, because we want to be able to use this data to help inform our legislators like Senator Harrell and others within, and our governor as they're making decisions. But Kelly, I'd love to hear from you. Can you share with us?
Yeah, absolutely. And thank you all so much for sharing such great wisdom and information. I think this is exactly what women need to hear. And I want to follow up with a little bit of what Commissioner Craig said, that so much of this information is changing on a daily basis, a weekly basis. We are just inundated with new things and changes and things that are happening. So the commission has two things we want to make women aware of. Number one, on our website, we have launched a COVID-19 webpage solely dedicated to resources and information that women can find on COVID-19. We are updating that all the time. So please check our website, fcsw.net. If you have any questions or want to do research or data, it is www.fcsw.net.
There we go. Just so everybody can see that. Thank you.
We want to do, most of you may know that we just wrapped up and released our Voices of Florida Women report. We traveled the state over about 6 months and heard from women from many communities about the issues important to them and their families. And that was from June until we wrapped it up in January, right when COVID-19 hit. So of course we realized that things have changed dramatically since we heard from women and we did our initial survey. So we are launching a new survey, a follow-up survey. It's not going to be open very long. You can go to our website, fcsw.net, and follow a link from our homepage. We're going to leave it open until June 15th. It's very short. It only takes about less than 10 minutes to fill out. But we want to know about the impact that this pandemic has had on women and families in the state of Florida. We see from the statistics that women have been disproportionately impacted, and we want to be able to have some real data to present to our leadership on the local and state level so that they know how to move forward. And I suspect that we will have more of these in the future, as you know, over the next few months as we go through different stages of recovery from the pandemic. So please check in with us and stay in tune to our website, because we will keep communicating with you through that system.
Great. Thank you so much, Kelly. And I want to thank each one of you for making the time for sharing. We look forward to doing more of these to communicate. We want to hear from each of you women from around the state of Florida, because we want to bring that. It actually will be heard by legislators throughout, and those that are decision makers and even in businesses. So it's a part of the equipping process. Women are key to this, to the state of Florida's success, to our families, to our children. So we can't thank you enough for all that you do. Thank you, fellow commissioners, for your time tonight, and we look forward to future conversations. You all have a great evening.
Thank you. You too.
Thank you.